I have a couple of roles. I'm an emergency physician by training, and I'm the director here of the CDC-funded Injury Center. The Injury Center's main mission is to decrease the burden of injury among our population at large. Most of our focus is among adolescents, emerging adults, and then vulnerable populations in our communities that have the lowest resources. We have a couple of strengths and focus areas: transportation injury, violence-related injury, concussion, suicide, and prescription drug overdose. Transportation-related injury has been a really great example. We've seen tremendous strides nationally over the past 30 years in addressing, from the 1970s till now, in decreasing what used to be thought of as accidents and really are now thought of as preventable injuries. And in the realm of injury science, most of the things that we think of as accidents, we now come to see as a preventable injury, and therefore we can apply the science of prevention to it to decrease it. What I'd like to see happen is to take some of the lessons we've learned from motor vehicle crash, for example, and have that applied to other leading causes of death, such as violence, which people still think about socially as being an accident or inadvertent or a social problem that can't easily be addressed, but really has the same science can be applied to it for risk and prevention factors that could have the same outcome of decreasing it in vulnerable populations and see the success we've seen with motor vehicle crash. We've made amazing strides in injury prevention and policy and in healthcare overall among our population. However, there's large parts of our population that are still very vulnerable that we haven't really made much impact with overall, with big disparities. So I think for healthcare, as we go forth, looking at how we can help the parts of the population and the most vulnerable groups come up to level with everyone else. For example, violence remains the leading cause of death among our African American teens and our teens in the inner city. Those are big challenges that we face. IHPI has been amazing in bringing together really the leading minds as well as the trainees associated with healthcare policy and healthcare service utilization, bringing those people together and having them have multidisciplinary conversations that they just wouldn't have otherwise, which will lead to answering questions that we didn't even know were needed. We have a niche interest in injury. However, the overarching interest in policy and in healthcare service utilization overlaps with the expertise that is at IHPI, and therefore makes a natural marriage for us in deepening our quest into injury particularly. We're currently working this fall in 2015 to collaborate together to put on a national State of the Science conference on concussion as one, and another on the emerging epidemic around prescription drug overdose. And in both of those are injury related and related as well to policy and healthcare civilization. And in that way, we found great collaborations and ways to bring together leaders across the nation with the researchers that we have here as well as with stakeholders across the state who can then gain that information and then go on to use that in a policy way. I would like us to be able to find a way to be able to address the health disparities in some of the larger community efforts that we have to make sure that the healthcare we're delivering to everyone equally, to be able to raise the level of healthcare for all Americans to parity. Together is how we'll be able to move forward. We have niche content expertise, and they have a broad view of resources and expertise, and together I think we'll be able to make great things.